My name is Dr. Story. I've been a chiropractor for over 24 years. I have a special guest here today. He's another chiropractor. And what we're going to do is we're going to talk about things that actually you should know that you probably don't about chiropractic. So this is a friend of mine. His name is Dr. Lai. I'm going to have him introduce himself. But we've been friends for, holy cow, we've been in practice for 25-ish years, something like that. We knew each other in school. For some reason, the universe brought us together and we just have kind of similar philosophies. But we actually practice much different, so I thought it'd be interesting for you to see how different chiropractors deal with different types of problems. So Dr. Lai got his education from Los Angeles College of Chiropractic, and then as we were practicing to get in the same Ventura County, he went and got another education, more student loans. So why don't we explain what your basis of your business is?
Well, we went to school together since 1993.
93, yeah.
And we know each other since back then. And we graduated in 2000. Well, you graduated in 2006. No, I'm sorry, 1996.
1996.
And I graduated in 1995, 4 months apart. And after 7 years of practice, I just got bored, of chiropractic, in terms, not chiropractic bored, but just bored of the cases that came through, your typical neck pain, back pain, headaches. Those are just kind of, simple really. I mean, for some of us that know what we're doing.
It's basically like being a dentist and just cleaning teeth all the time. That's basically what it is. So what did you do after that?
Well, in 2002, I went to a funeral service. A chiropractor passed away, Dr. Chang, Albert Chang. He actually was a chiropractor and acupuncturist, and that day at his funerals, I decided, I'm going to be just like him. I want to be a chiropractor / acupuncturist.
So you combine the both. So the name of your business is?
Chiropuncture.
To combine both. So even though we're friends, we have a lot of differences in terms of how we manage certain cases, and that's what we're going to talk about here. So let's first talk about when a person first comes into the office, what are the blinders that we have on, or how do we try to open our blinders to see patients? So if a patient comes in, and many patients don't come in, by the way, with back pain. Many patients come in with back pain, diabetes, liver disease, kidney disease, high blood pressure, all these things. So with your extra training, where do you actually start with a patient that's got all those problems?
Well, you basically have to go back to the basic, right? I mean, first you listen to the patient, what they present in front of you, and take the information, see what applies to them, and not so much impose your idea, but listen to what the patients are telling you and what their symptoms are, or disease process is happening.
Okay, so in chiropractic school, a lot of times on YouTube, all you see is the cracking, and it's quite frankly kind of silly when people sometimes ask, do you watch other chiropractic videos? The answer is not really, because a lot of these videos are simply, they seem like they're for more entertainment purposes than actual really reality of what's happening. But what Dr. Lai said is really what you don't see a lot of times is the actual backstory of, we actually listen to the patient and try to figure out. Now, do you remember this in school? I think they told us that like 90% of all diagnosis is shutting up and listening to the patient and the exam.
Well, exactly. That's one thing. The biggest thing I learned from one of the teachers says, as Clarence Gonstead, he basically says, listen to your patient. They tell you the problem if you listen carefully, and instead of you imposing your idea or wanting to sell somebody on something, in fact, just listen to what they're telling you, and a lot of times they will give you the answer right as they're speaking, and a lot of times you don't need to examine them. I don't know. For me, it's been through my experience that
it starts to become intuitive.
Intuitive, where you don't need to examine people. Yeah, you do the exam to make you look like you're smart and the patient feels like they got your money's worth. But a lot of times through experience / wisdom that certain things, that sounds like a pelvis problem or occiput problem or neck problem. It's pretty simple after a while.
So here's a good question. So one of the things that's interesting about when you watch YouTube and you don't really see this, and many times people will comment, oh, do you need x-rays, do you need MRI, and things of that nature. What's interesting is this is very difficult, at least for me. Let's see what your opinion is on when it comes to X-rays and MRIs. When you get an MRI, the doctor actually probably should know what the problem is before they even order the MRI. A pinched nerve, when someone has pain in their back, it goes down their leg, it goes down to their big toe, they're numb, they're tingling, they're burning, it hurts when they sit down, it feels better when they stand up. What idiot does not know that's a pinched nerve? That's very likely a disc herniation. What's interesting about dealing with real life practice is I find that you actually have to sometimes send the patient for the MRI, and the patient will go, oh, thank God we're going to find out what's wrong. We already know what's wrong. We don't need an MRI. What you're getting an MRI for is a lot of times to CYA, cover your tail. The second thing is to really find out how big the disc herniation is. Now, what's your take on that?
Well, let's start with the X-ray first, right? I mean, a lot of times, as you know, both of us started with X-ray in our practice early years, and you maybe 10 years later, you said goodbye to your X-ray machine.
Actually, the actual true story was, I had an X-ray machine for the first 7 years of my practice that was in the facility I was working. Then I moved to another practice, bought the highest level X-ray machine. Remember that thing? That thing could cook steak. A person could come in 300 pounds, I could get a very clean full spine X-ray. And what ends up happening is, after about 10 years, the technology changed from actual film X-ray to digital. And I was contemplating moving my facility to a different location, the current location. And what ends up happening is the technology changed. It's almost like I had a horse and buggy, and we now had Tesla cars. So I was debating on whether to get a digital X-ray. And there was an X-ray facility downstairs from me, and I could very easily just send the films down there. And what was happening was, every once in a while, remember our the processor would break, or you'd have to buy a new processor, and those
are
like,
you have to get it serviced every month.
You have to get serviced every month, and that was like $150 or whatever it was. And then what ends up happening is I realized that I really wasn't, like you were saying, I was becoming more intuitive and not looking at X-rays. I think when you're first in practice, you need some confidence builders, and I think X-rays really give you confidence. It's almost a no-brainer for a patient when you go, there's your problem, and you point to an X-ray, and the patient kind of believes you. It's hard to say, hey, I've seen this 1,000, 10,000 times. You have a pinched nerve. You don't need an X-ray right now. There was no trauma, that type of thing. So even though X-rays are valuable to some degree, we rely less on X-ray now, and so I sold my X-ray because I just didn't feel like I needed it and needed the cost, especially when insurance companies were paying us next to nothing for X-rays. And but that's the story behind why I got rid of my X-ray.
Well, I got rid of mine too. I mean, I got rid of my X-ray too for many reasons. The first reason is I found myself not using it as often as I used to, for one, and two, of course,
because we had more experience.
Right, and then the second part is that, of course, the cost involved with maintaining the chemical. If you didn't use it, either way, you have to get the chemical service every month to be able to develop / wash the X-ray. And thirdly, as you stated, it got to the point where you didn't need the X-ray anymore. And for me, because of the training I have with acupuncture, it got to the point where I didn't need another tool to sell somebody on what they needed per se. I mean, if I was a chiropractor only, I would probably kept my X-ray, but with the level of experience that these days, there's really no need for an X-ray. Not only that, you just go down the street to the local radiology place, and they can do for dirt cheap. And also,
now what's funny about the local X-ray place here in Camarillo is that sometimes you'll send a patient for an X-ray and their processor is down or their machine is down, and I just have to laugh because I think to myself, that could have been me, you know, because you know how much it costs to actually fix those things. So to be fair to X-rays though and MRIs, on the flip side of the equation, the other hand, I would say x-rays are great when the conservative care you're providing is really not panning out the way you want. Or what you're looking for is sometimes if you want to see if their pelvis is unlevel, if you're going to put a lift in, you want to make sure how many millimeters you're putting in. And there's kind of a generalized mathematical equation based upon how much their sacrum dropped, how much curve there is. You never want to put a lift inside a short leg if that short leg is on the concavity of a curve, because you're just going to make the curve worse even though you're making the leg shorter. So sometimes there's reasons to do it, but I don't x-ray every patient. And another thing about the people that say, oh, you should x-ray every patient that walks through your door, to me that's kind of ridiculous, and the reason why is, well, what do you do for babies? Number one. Number two, you're limiting your ability to treat pregnant people because you really shouldn't be x-raying pregnant women. The third is, I would say most health conditions we deal with, at least musculoskeletal, very seldom it's an acute injury, like a car accident or a fall. Most of the time it's a developmental condition where they've developed strain on their joints. Would you agree with that, or that's what I see?
I mean, let's talk about what misconception people have about X-ray. I mean, some person when they have back pain, for example, or neck pain, for example, they automatically assume that they need an X-ray.
Right.
You know? But as you know through experience, when you listen to the patient, they tell you the story, you can get an idea if they need an X-ray or not. So I mean, we're not saying that it's not necessary to have X-ray, but it's warranted through the history that we do the X-ray if required.
So if you're looking for a chiropractor, I would recommend, and this is just my humble opinion, but you want to go to a chiropractor that's going to sit down with you first and listen to you. That's what you want. You don't want someone taking an x-ray first. And I've personally been to orthopedic doctors where the staff brings you into the x-ray room first. And the doctor won't see you unless there's an x-ray. And that to me is ridiculous, because what if it's an IT band problem, or what if it's a soft tissue problem? So I would say find a chiropractor that actually sits down, finds out your story first. The second is does some form of ruling out or ruling in, or gives you some justification as to why you would need an x-ray or not need an x-ray. I mean, that's basics right there.
Yeah. And as far as MRI, I mean, obviously it has more diagnostic value than x-ray, especially when we're looking for soft tissue in terms of the disc.
Right.
You know, a lot of times people would think that they're A-okay with the x-ray and then they'll have a negative finding MRI,
Yes.
but that's not always the case, right?
Yes, yes. So I had recently, it's interesting, I should show you this MRI. I think I have it somewhere. I had a patient who had drop foot, and I thought, okay, that's a bad thing. Drop foot's a bad thing. Clearly it's a pinched nerve. We started working with him, and he was getting better, but he wasn't getting better like as fast as I kind of wanted. That's the other thing about being in practice for a lot of years, is you kind of know about how long it's going to take. And so he wasn't really getting better as fast as I wanted. So because of the drop foot, I was like, hey, let's get an MRI. Then there was a big issue with his insurance. His insurance denied the MRI. We had to get approval, blah, blah, blah. So we eventually got an MRI, and the MRI showed, and I'd never seen this before. I've heard of it, but I'd never seen it. His L5 disc herniated and actually migrated down, yeah, exactly, down into the S1 area, down into the sacral canal. And I thought, oh, this guy needs surgery. This guy needs surgery. And I told him, I think you're in trouble. I think you need surgery. So what ends up happening is I sent him to a surgeon, and it's interesting. A good surgeon is conservative. And because I thought this guy was going to sign him up. I thought his appointment was Monday. I thought he was going to have the surgery on Tuesday. He was getting better, though. That's, again, the clinical part. He was getting better, so the guy says, why don't you continue with conservative treatment for another month, and let's see how you do. Well, it turns out, yeah, I was shocked. I'll tell you the name of the surgeon. We're not going to say it on camera, but the surgeon says, why don't you give it another month, we'll do a follow-up. And the surgeon actually told the patient this, that I thought was fascinating, and kudos to the surgeon. He said, we don't do surgery on MRIs to make MRIs look good. We do surgeries on patients. I mean, how many times do you hear about people going, oh, I have an MRI, or that MRI place in, I think it's Arizona, that says, send us your MRI and we'll diagnose you. Okay, that's not a good spine surgeon place, whatever. So anyway, lo and behold, I didn't think this was going to happen, but it took about 5 months. The guy's back to doing jiu-jitsu and everything, and he still has that disc herniation, no more drop foot.
Wow.
He's functioning good. I'm just so thankful that the stuff that I did actually worked, because, you know, it doesn't always work. But I say kudos to the surgeon for not doing surgery and recognizing that conservative treatment can allow time. So now let's
as you know, it's some of the drop. When you see drop foot, it's bad news.
It is
really
bad news.
You know,
it is bad
really
news.
You have really a deep concern for the patient and their outcome, because it's just bad news. That means that the nerve that's going down your leg is blocked or blocked significantly.
Right, and nerves don't heal fast.
At a rate of 1 millimeter a month.
1 millimeter a month, so that's the way it goes. So now we're going to talk about how do chiropractors actually develop their techniques. And Dr. Lai and I have been in practice a long time, and what we were talking about the other day and what sparked this video idea was that when we first got out of chiropractic school, we had an idea of how we wanted to practice. And we have both evolved, and we've actually kind of evolved in different ways. But what's interesting is when watching YouTube, it seems like YouTube is a very secular, you have to do one thing. And sometimes you'll watch YouTube and see chiropractors, they literally do the same treatment to everyone. It doesn't matter whether they have a spondylolisthesis or a sacroiliac joint problem or headaches. They do the same series of adjustments to literally every patient. Once you've seen one video, you've seen them all. And then there's other chiropractors that seem to do more specific types of treatments geared towards their problems. I'm thinking of Dr. Ian, the first guy that was probably on YouTube that made it famous. He was very specific. And there's other chiropractors that have their own spin on things, maybe an AK doctor that does muscle testing. So what has been your evolution of the chiropractic portion of your practice on technique?
Well, obviously we're not here to bash anybody, but I mean we want to set the truth and how we see the truth is. You know,
Yeah.
I mean, usually when a person comes to my office and they tell me that they've seen to this doctor's name, that doctor's name, I can give pretty much a good idea what their results are based on the doctor's name.
Yeah.
I hate to say it, but that's the truth.
We know everybody in our county, and if you've been to Dr. XYZ, we kind of know what he did. Yeah.
So let's talk about that. I mean, I think there's two categories that follows under for chiropractic. We have the generalist and / the specific, right? I mean, there are those that you come in, you call the flying 7.
Yeah, we learned it in school. I remember the flying 7, and it was adjust the sacroiliac on one side, adjust the sacroiliac on the other, do a bunch of anteriorities where you basically give them a bear hug, you do 2 scissors moves, and you do 2 neck moves. That's 7, right?
Yeah.
Yeah, I think, yeah. 1, 2, 3, 4. Anteriority is 5, and then both sacroiliac joints are 7.
So if you didn't understand what you're saying, basically when you first start out, you lay on your side, the person gives you a motorcycle kick on one side, give you a motorcycle kick on the other side,
Yes.
lay on your back, crunch, 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 bear hug, and then lay on your back again, left on the neck, left on the right, get out here, you're good.
Yeah, it takes 30 seconds.
And there's really no palpation involved, meaning checking for the specific one. You know, in school, when we went to school, our teacher told us, find the one that's not moving, move that one only.
Yes.
They didn't say move them all, but so that's one of the problems with some of our peers is that they gotten lazy. I just have to use that word. They just gotten lazy and just do a generic adjustment. It's just kind of like a shotgun approach versus sniper mode. So I always tell my patient, I am using sniper mode. I just one bullet, boom, hit the target.
I like that. I might use that. Watch out, patients. Here comes the sniper. And there are patients that actually like to have everything moved, and that's just the way it is. But you have to, I think, understand that if you're getting the same treatment as everyone else, it's almost like if you went to a medical doctor, and it doesn't matter whether you have a cold, a flu, a bacterial infection, a broken leg, they give the same antibiotics to everyone. We used to joke about it. I mean, it used to be, I think in school, at least for us, it used to be kind of a standing joke that if that's all we have to do is the flying 7, what's the point? You know, but it makes for good video because there's a lot of noise.
Let's talk about the negative side of it first of all. The
negative
side, the flying side. I mean, for one, you're ripping tissue or injuring joints that doesn't need to be injured, for one.
Yeah.
And two, the person can feel sore. They're going to say, my God, I felt worse than I came in.
Yeah. I think also, in addition to that, one of the confusing things with me is I'm a chiropractor, but I'm human too. I need like tune-ups every once in a while. And if I wake up and have a neck problem, I don't want you adjusting my wrist. I don't see why you need to adjust my knee or my hip or my back. Fix the problem I have. That's why I'm in the person's office. A lot of times you'll see people, well, they have a headache and then they start adjusting their fingers, adjust their wrist, adjust their elbow, they eventually get their neck. But what's happening, I think, and Dr. Lai mentioned this, is that you're doing mobilizations or adjustments or manipulations, whatever, to me it's a manipulation, of doing something to an area that has no need. Why risk that? You know, if someone has back pain, the most confusing I think is when people have back pain and the chiropractor does a flying 7 and adjusts their neck. Now someone needs to explain that to the patient well enough so the patient to understand. But you have to think of the general public. If the general public says, yeah, I went to a chiropractor for back pain and he cracked my neck, whoever he's explaining that to, that's a hard sell. Now, surprisingly, there are some reasons why you would adjust the neck, but it does have to be explained, and you do have to find those problems.
Well, let's talk about the soreness that someone feels or sometimes feel worse. Now, both either from a generic adjustment or a specific adjustment. It goes both ways, right?
Yes.
You can be more painful from a specific adjustment and the generic adjustment. Let's talk about that then.
Okay, so I've been adjusted for billions of times, and I have found that when I get adjusted, normally I don't get sore, but if I do get sore, it usually is kind of that almost like a good sore a little bit. I don't know how to explain it, but if I go in with low back pain and the chiropractor adjusts me and it's a good adjustment, I will probably feel some what's called sclerotogenous, I don't know how to explain it, sclerotogenous type of pain, like a dull, achy, like something was moved in my body.
Well, just that feeling of you haven't worked out in a long time? Feeling.
Yeah, that's how it feels. But again, if I have a low back problem and someone adjusts my low back, my middle back, and my neck is sore, that's usually more likely just overstraining the tissue. Yeah. Because there wasn't a problem in my neck to begin with. So
now, granted, the soreness is always not a bad thing. I mean, sometimes when somebody gets a deep adjustment, or I call it a deep adjustment, they may be been to 4 or 5 other chiropractors, you know, and they come see you and all of a sudden, wow, what was that? That was an adjustment?
Yeah, that was an adjustment.
Because they never experienced that sniper mode.
So let's talk about the difference between a manipulation and an adjustment. To me, I'm just going to say it, this bothers me. I understand it attracts attention. I understand it's clickbait. I understand this is the way people think. But we don't call it crack. We don't sell crack. No one walks out of my office with a little white baggie. You know what I mean? So when you see videos from other chiropractors, and I totally get it, they're trying to attract your attention. The biggest crack heard around the world. Man manipulates woman. I mean, I saw one the other day. It says, cracking her peach. Now come on. We're going a little too far. But I'll tell you what, people are watching, so that's what counts on YouTube.
People like Hollywood, you know.
People like Hollywood.
Being adjusted ourselves so many times in our lifetime, a lot of times you don't hear the noise. And it's a rare occasion or very few percentage that you actually hear the noise across the room.
Yeah.
But what you hear on the video, those are microphoned up.
It's microphoned up, it's accentuated. It's really, I'm not going to say it gives the profession a bad...
it does.
It does. Let's face it, it does. Because you know what? Since YouTube got started with a lot of the chiropractic videos, and you can tell me your experience, I have had to try to defend a lot of what people see. When people come up in my office and they're scared to death, and I say, have you seen chiropractic on YouTube? And they go, yeah, I have. And I go, it's nothing like that. That's like reality TV. And so when you actually see an adjustment happen, it's actually not like what you see on YouTube. These people are putting microphones up to and accentuating the noise. But an adjustment to me is finding an area that's not working well and making an adjustment to make it work well. That's as simple as it gets. A manipulation is where I try to impose forces upon an area that I decide, not that the person's body decides. So if I examine a person and I find, let's say, L4 is the problem, I'm going to adjust L4. But I can manipulate any bone. Just give me C4 and I'll manipulate C4. That doesn't mean that that C4 needs to be adjusted. I mean, that's my take on it.
Well, why don't we go into the venture of get in trouble now? I mean, let's talk about Dr. Johnson, right? In Texas.
Yeah.
I mean,
yeah.
he does this thing where
amazing guy.
What's it called?
Ring dinger.
The ring dinger, right? I mean, we see that and we're shaking our head.
We're shaking our heads.
I mean, not to discredit Dr. Johnson, but that's just manipulation.
Yeah, we don't.
There's no palpation.
What is
you're not checking for anything. You can just be a bodybuilder dude and just yank on people's neck.
I think the fear is that the general public thinks that this is fun and that they can do this, and that people are probably wrapping towels around their friends' heads and thinking that they can do this. I think Dr. Johnson does like biophysics or something, but it's not the biophysics that you learned. No, biophysics was using weights and teaching the nervous system how to adapt to altering posture. And I have another video, by the way, I'll put a link down below. It's called, speaking of clickbait, I titled it Dingers, Y-Straps, Yoga Pants, and Bras. But it's down below, I'll put it in the description, so you can get my official opinion. But we just don't do it because, at least the clientele that I see, I just don't think it's a safe thing for the patients that I see. There may be some indications for it, but I just don't see it in my particular practice. But I think for every 10 people that want to see a chiropractor, there's maybe one that wants that aggressive way. It scares nine other people away from chiropractic. And that's
I would agree with that. Majority of the time when you see these ring dinger adjustment, it's for the select few. It's not for the many. The many would not like it. I mean, if you take a 110-pound female and you do the ring dinger, that person would not like you.
They're not going to like you. And I think the skill level to do it is not respected by the people that are watching YouTube. If you have a 110-pound person, if you have a 300-pound person, the forces that need to be used, you hope are required. But you've seen other videos where the person literally pulls the person with a strap and the person literally goes flying across the table. And sometimes if you watch some of these videos, you could see the fear in their eyes. They're on camera. They know to not say to someone, "Don't ever do that to me again. I'm never coming back." No one's going to say that on camera.
Well, let's get personal. How many times have you been adjusted by ring dinger style then?
I've never done it.
No, have you received yourself?
Never.
I've received maybe 5 of them.
Really? I've never had anybody put a towel around my neck. First of all, if a chiropractor...
Let me correct that. No one has ever put a towel on my neck. Yank on my neck, but although an
occipital lift.
Yeah,
okay,
yeah.
Well, to me an occipital lift is a gentle, specific, if it's a specific, gentle adjustment, it does wonders.
Yeah.
But adjust the occiput. You should not be feeling it in the back.
Or the small of your back.
Or the small of your back. That means if I did that to a patient and they said, "Boy, I felt that in my back," I obviously, to me, I use too much force. Because I will use like a crane maneuver where you actually pull, but my goal is to try to get that clean adjustment of the occiput and very little else. But if I'm pulling so hard that they're coming across the table, to me, this is just my humble opinion, I'm doing something wrong. So now let's talk about the way a holistic provider sees healthcare versus the standard medical in our country. So why don't you start?
Well, as you know, there are more people going to see quote-unquote alternative healthcare than conventional care.
Yeah,
First of all,
numbers of visits, it's interesting.
We are not alternative. We are mainstream as far as holism.
Absolutely. And that probably shocked the medical world when they did that study.
And of course, now they want a piece of the pie, right? I mean,
Absolutely.
they're using lingo to grab your attention. For example, the word of early detection.
Early detection, these
But,
things,
you know,
preventative,
preventative,
holistic. The
but
word
then that-
holistic is just all over the place.
The word preventative is used very loosely, and we need to actually get some clarification on that. For example, breast screening,
Yes.
right? It's not prevention, it's early detection.
Right. Don't forget, you're getting radiated in a tissue that's cancer sensitive.
Yes.
That's not preventative.
No, and actually, let's talk about mammogram. I mean, I know that with mammogram, obviously we're exposing the person to radiation that they didn't have, which is sensitive to radiation.
Yeah.
But actually, what's more appropriate for, that's more diagnostic value, is tomography.
Yes.
Tomography
Yes.
of the tissue. If you don't know tomography, it's just basically you're scanning the body for heat differences.
Yes.
It will actually be more sensitive than a mammography, because on a thermography, the tissue is, the camera is picking up the heat in your body. So cancer or anything that's active will show up more red in the thermography
Yes.
versus something that's not active. So it's actually, thermography is more diagnostic than
And you'll
mammography.
probably, hopefully, see that more being done in the future. We don't know how long it's going to take.
Well, it is offered.
It's offered now, but it needs to be more of a
practitioner
standard.
that knows about it, we would refer somebody, a facility that has a thermography device
Yeah.
that can detect it.
Yeah.
Which is a lot
Now, what's
more
funny
than
is when we were in
thermography.
school, speaking of like differences of healthcare, chiropractic was still looked down upon with like physical therapy and things of that nature. No one ever talked about alignment. Now, well, when we went to school, there was just physical therapists. Now there's doctors of physical therapy. And you know what they're doing? Adjustments. Or they're at least they're
Well,
trying.
actually,
They're
manipulation.
doing manipulations,
Sorry.
truly. But the truth is that people want a piece of the pie. When they realized, when this study came out, and I forgot what year it was, that they found that more people were going to holistic healthcare providers than medical doctors, I think the whole healthcare industry of medicine went, we're losing the battle. We're losing the battle. There's something these people are doing that we need a piece of. And what's funny is the physical therapists went from, physical therapy and chiropractic are like that, to all of a sudden they want to start learning how to manipulate joints. I thought that was funny.
Well, for you, the chiropractic world, that, you know, we grew up in the profession knowing that that's one aspect. But for me, as a chiropractor / acupuncturist, I'm getting that same treatment now, because the physical therapists are doing dry needling.
Yeah, they call it dry needling.
Yeah.
I don't think they know really what they're doing when it comes to the analysis part. I think they're just putting it where it hurts.
Well, I have actually 2 phone calls recently that 2 different individuals call me, ask me if I do dry needling, and my answer is yes.
That's called acupuncture.
That's called acupuncture.
But actually, acupuncture is more than just dry needling. I
Yeah,
think.
we've been doing it for 4,000 years. We're the originator of acupuncture / needle.
Yeah.
Right? And so the lady said, well, dry needling, it's different. They use longer needle. But lady, if you want me to use 5-inch needle or 10-inch needle, no problem. You know, that's not a problem.
Bring it on.
And so let's talk about, I'm just talking about really what's the difference in going to acupuncture that does acupuncture needling versus a medical doctor / a physical therapist
Doing
that
dry
does
needling.
the dry needling. Well, the difference is this. Let's say you have pain in the genital urinary area, your pelvis area, or you have pain in your eyes. Would you want me to put the needle in your eyes?
No.
Because that's what you would do if you're a medical doctor or a physical therapist.
Yes, because they're not really learning the full scope of the reason why that you're using a needle. A needle, to me, and I could be wrong, I'm just going to say it and we'll see if he likes it. To me, the needle is just a stimulus to make change internally in the body. So whether you use a long needle, short needle, thick needle, whatever, you're really using needles to stimulate or slow down processes in the body to create balance. I don't know, is that right or
Right,
wrong?
I mean, the needle is basically, you are stimulating. You can use needle, you can use your thumb to rub it, acupressure.
Yeah.
So that's one of my pet peeves, if you will. Acupressure is not acupressure if you don't know the principle of acupuncture. Right?
Yes.
So when somebody is saying they claim they do acupressure, well, they're not doing acupressure, they're just doing rubber-dubby. They're just rubbing you. True acupressure is applying acupuncture principle or knowledge of channel flow and applying the thumb to that area, or you can do laser, you know. Basically, whatever how you stimulate is fine, as long as you know the theory / the principle behind what you're trying to accomplish.
And you're not learning that on YouTube. What do people not know about chiropractic that they really should? I'm going to say most people really have no idea what it takes to be a chiropractor because of YouTube, because people are watching these things and thinking that it's just cracking spines. And you can see in the comments, oh, I wish I was a chiropractor, this type of thing. I went to school for 5.5 years to get my bachelor's degree. Then the chiropractic was 4 years. It's a lot of schooling. And because YouTube is for entertainment, we tend to forget the behind the scenes things that go on. And people really have no clue. A lot of times, people, there's some comments, and you can read comments. You're not a real doctor, you're not this and that.
Well,
You know what?
well,
Why don't you just call the state board?
Why don't let's
Tell them,
let's
you know?
demystify that. First
Okay.
of all, you're pre-medical, or you know, anybody that goes in the medical field, what's required?
The pre-med.
You basically
Pre-med.
you max out all the ology. You know, the psychology, biology, human, you know, all the ology basically.
All the
right?
ologies.
All the ology of your community college or your state
whatever
level
college you went to.
college, right?
Yeah.
So that's 3 years, 4 years, whatever how long it takes you. You max it out.
It took me 5, not because I'm stupid, but because at first I was actually an art major. And so I got through 1 or 1.5 years of college in art, and then, you know, the miracles happened, the chiropractor fixed me. I was like blown away by what the heck is this? And changed my major and had to literally start over. So it's not that I'm stupid. It just took me 5.5 years to get my bachelor's in it. But no, people don't know. People have no idea the education level.
So what's involved with chiropractic school, by the way? What do you start out with?
Well, here's the thing. When we went to chiropractic school, I look back and think that really was the best time of my life. That was so much fun. Basically, it was from 8 in the morning till 5 at night in class.
No breaks.
No breaks, really.
Except lunch.
Well, we had lunch, but lunch was just, you know, you ate lunch and you went back to class.
Or you study while
And we studied during lunch and we quizzed each other. And then I remember we would, I lived near the school, and we'd go get dinner or something like that. And then at about 6 or 7 o'clock, we'd go to the library, and we'd be in the library studying till 11 o'clock at night. And that was a day-to-day, every 5 days a week. It was, when you look back and you go, God, our classes, it was like we were taking 40 units a semester. And 3 semesters a year, by the way. There was no summer off.
Trimester.
Trimester is what they called it. And
So it's 15 weeks, 15 weeks straight.
15
2
weeks straight.
break.
So we had 45 weeks per year of school. But looking back, it's almost like childbirth. During the time, it was exhausting. You're always tired. You didn't know, you know, it was a juggling act to try to figure out what is the most important, what's the next test that we have to do. But chiropractic school is grueling, and I don't remember your class, but I think your class was very similar to mine. We started out with 150 people. By the time we graduated with 80 something.
Oh my gosh! So ours was about the same. We
not
started
everybody makes
150.
it.
We
Yeah.
started 150 classmates, and we graduated with 108 or 105. And some
This
of those
class
were,
was smarter than mine.
but some of those were actually from other classes that were those other students were
Actually?
slower or you know
Well, they
remedial.
failed classes.
You failed classes.
They failed
basically.
classes. It was no walk in the picnic.
Now, this one area you didn't talk about is when you first started out the first year of chiropractic school, you had a cadaver for the whole entire year.
Yes, you're
right?
studying cadavers. We had a group of, I think we had about 10 cadavers.
10 person.
Or no, 15 cadavers, 10
person
people per cadaver,
cadaver.
and you studied anatomy. Basically, here's the thing. Everybody says this. It's like medical school. It may or may not be, but the thing is, for the first 2 years, you're studying anatomy, physiology, chemistry, pharmacology, x-ray, blah, blah, blah. Some of those subjects we study more of than your average medical doctor, like x-ray, obviously spinal adjusting, these types of things, anatomy. But there's, a lot of the subjects that we focus on, we have more training in than your medical doctor. But of course, your medical doctor has more training in the pharmaceutical stuff.
Or the mode of treatment. The mode of treatment is different.
The mode of treatment is different.
But
so the last couple of years,
the
the foundation's the same.
Science is science.
The science is science, and so the foundation of when we finally get into clinic and the cases we see and things of that nature, and the rotations and the internships, it's mainly focused on what we do, which is chiropractic. You wouldn't want your cardiologist learning how to adjust your spine, but you don't want the spine guy doing heart surgery. So that's the way it is.
But let me point out a point that you actually glanced over. It was like nothing. A lot of people don't know what's involved to be a chiropractor. They think, so, we're just learning how to crack people. No. I mean, we've spent a whole year intimately with a cadaver / cutting. In fact, the first week of school, we got a 4-inch saw blade.
Yes, I remember that. Yeah, you learned the why.
You cut the rib cage. You go up the kitchen and you open it apart and you study the heart. That was the first thing we learned.
That was actually the first thing.
And you smell the lovely smell of burning bone. You will never forget that. Let me tell you.
Actually, you don't.
You don't forget that. And so a lot of people don't know that because of the detailed learning we got from our education, it puts us in a position to make sure that we provide safe chiropractic care. I think that's one of the takeaways. That people don't understand that we spend so much time of our life dedicated to learning how the body works and what the body looks like underneath with a real life or dead person that we did a dissection on. A lot of people don't realize that. And when I tell them that this is what we started out with, they are shocked.
Yes.
They are shocked that a chiropractor actually did full-on cadaver dissection. They just think we're a massage therapist.
No. We did not study anatomy through netters. Through a book. So here's the last thing. This is what we're going to finish off with. Let me see if you remember this, because for some reason I remember this, and I made a T-shirt about it. On top of in our cadaver lab, where we stored the cadavers to keep them cold, there was a sign. And it was in, you know what I'm talking about, because everybody remembers this sign. And it was in, I think it was Greek. It was ancient Greek. Do you remember what it said? It said, mortus vivos docent. And I don't know why I remember that. Mortos vivos docent. And they told us that what it meant was, the dead teach the living.
Wow.
And that kind of hit me in my heart a little bit, like, wow, these people actually donated their lives to help us learn so that we can also help the living.
I have to agree. As you know, when we finished our first year with the cadaver, it was very nice when we had a
ceremony for the people that
donated the body to science. And for me, that was very tear-jerking.
Yeah, that you started to think, because after a number of weeks and months and stuff like that, you just got down to business. You go into the cadaver lab, learn what you need to learn, study it, make sure you know the variants and all these things. But we forget that these are you. These are your grandparents, your parents, your children. And so that we appreciate the fact that the dead did teach the living.